Good morning. Good afternoon. Good evening. Namaskar. Namaskar.
Namaskar.
Welcome back to this path class. Hope that everyone is doing well. Just now understood from Cornelia that there is some trouble in the Texas state and some difficulties are, so some of our family members can't join us today. We will miss them for today's session. We believe that all that we are understanding from this class, we are applying them. Maybe little, maybe little. We believe that for sure every one of us are using this information in their own life or families or friends or somewhere. By doing only, we will learn and remember the experience. It will help us to gain the more and more confidence. Do it and then share it with the group in the WhatsApp group or here, whenever and wherever get an opportunity, chance. What happened? Some of your positive experience will motivate to others. Whatever the small experience, also very useful. And whenever you stuck or stop, feel not comfortable, ask, feel free to ask. We are thinking and planning, not thinking, but the planning to schedule one of the Saturday, like we have 2 Saturdays our classes and still we have 2 more Saturdays free. So one of the Saturday we will schedule our like group call, like meeting with mentors. Maybe you will have more close group, close connection, possibility to ask more detailed questions. Maybe in this week we will fix which Saturday to schedule it, because right now we are talking and having this class on 1st and 3rd. So maybe either 2nd or 4th, one of the Saturday we will set up. And we believe that it will be helpful to all of us. Everyone will be happy to have this kind of the class, more personal connection with mentor. We believe that all of us are scheduling the online consultation appointment with the mentors. And not only scheduling is important, the more important is to be there, present in that online appointment, and to understand the whole consultation process. We believe that. Today, we are going to talk about the herbs and herbal remedies useful for skin condition. Few months before, in the month of November, we had a discussion about The herbs and herbal remedies, those are useful for the pitta disorder. So what is the difference that pitta and today? Because for the skin condition, also pitta is mainly responsible. In the month of November, we had 2 sessions, and in that we discussed about supplements like Pitta Samak, Gulka seed, Ayur seed, Chandrika Ras. Now we are going to talk about skin condition, useful herbs. So the point is, normally, Pitta is getting disturbed, imbalance, 2 ways. One, by quantity, means liquid pitta increases. Quantity wise pitta is aggravated. And so they can develop the pitta disorders like acidity, ulcer, migraine, headache, sometimes hypertension. These disorders, these conditions are because of the extra, more pitta, quantity wise. But when pitta is imbalance, means disturbed, means quality wise, pitta mixed with ama, toxic. Then they pollute the blood dhatu, rakta, blood tissue. And then they develop the skin conditions, different skin problems. Two different type of possibility can happen with the pitta imbalance. One, quantity wise, pitta is more excessive. And the second possibility is quality. So today we will talk about the if quality pitta is not good, then this pitta, impure pitta, vitiates and going to the blood dhatu and then polluting that blood dhatu, producing some different type of the disorders, and how to rectify them, which way, and which are the herbs, which are the herbal remedies are useful for them. So mainly in this, we consider as psoriasis, eczema, dermatitis, skin allergy, dandruff, pimples, acne, boils, all these conditions, and also hair fall. Many reasons are there for the hair fall. But one of the reason is due to excessive heat in the body. Hair root becomes weak and then they start falling. People coming with the concern of losing hair. Now, many reasons and many possibilities. Is not only one possibility, but one of the possibilities is heat, excessive pitta, due to some reason. To lose hair, one of the reason is low hemoglobin, low iron, low calcium deficiency. Hormonal change. So when we feel, we read, we observe that the pitta is excessive, there is a heat in the pulse, we feel heat from the pulse. Person is talking about hair loss, hair losing hair fall, then we give supplements from the group of pitta herbs, and along with that, the supplement useful to strengthening the hair root and hair growth. Which are the supplements, which are the herbs are helping to strengthening the hair root? We will talk about in the next session. Today, we have more about the skin condition and couple of supplements and ingredients we will talk in the next session. We have total 2 sessions, part 1, part 2. Yes, not to wait more. And to start, I request Dr. Komal and Cornelia, please take this session further. See you later with many questions.
Yes. So thank you, Dr. Hema, and namaste, everyone. So welcome to yet another session. So we will start with the prayer till the time Cornelia starts the slide. Just now we saw that there is, some of our family members are suffering from some problems. So to give them the mental strength, here is we can say a prayer.
Sorry, Dr. Komal, excuse me.
Yes.
I don't think so. Sachinji, are you there? Sarodeji?
Yeah, good evening to all. Yeah, we are there. Josna and myself is there.
Okay, can you please, is possible to, start your video? Yeah. Oh, good. So, I'm very happy to introduce our, 2 more members to our family from Dubai. They are they just joined this session, 3-year path education yesterday. They are very excited, both of them, Sachinji and Jyosnaji, his wife. Welcome, Sachinji, and I don't know if Jyosnaji is still there. Yes, yes. Welcome to our path family. Okay, good. Welcome.
Welcome.
Thank you. Thank you all.
Yeah, nice. Please continue.
Yes, welcome to the new members, and we will start with the prayer, as I told you, to give the mental strength. So I will just say the prayer. I think most of who know Hindi, they must be knowing this prayer. हमको मन की शक्ति देना, मन विजय करे, दूसर की जैसे खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम इतना कर्म कर, मुश्किलें पड़े तो हम इतना कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जैसे पहले खुद को जय करे, हमको मन की शक्ति देना, मन विजय करे, दूसरे की जैसे पहले खुद को जय करे, हमको मन की शक्ति देना, भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच का दम भरे, दूसरों की जैसे पहले खुद को जय करे, हमको मन की शक्ति देना. Yes, so we start our prayer. We seek blessings of Lord Dhanvantari and the Siddhaveda lineage, our acharyas, Vaidya Jivaka, Baba Ramdas ji, Pankaj sir, Smita madam, and all the acharyas who have made this possible to bring this all this knowledge with this technology at the click of a button. Really, we express our gratitude, and my Guru, Sadguru Veda Bharti Maharaj. So with that, we start our today's session. So we are going to discuss, as initially told by Dr. Hemang, that we are going to today learn about the herbs that help in the beauty, that is the skin disorders and the hair disorders. So the herbs like we will study today, the Sanskrit name of the medicinal herbs like Khadir. So in the bracket there is the scientific name, and out of the bracket the first word is the Sanskrit name of that herb. So Khadir, then the scientific name is Acacia catechu. We will study that. Second herb is Bakuchi. The name is Sorelia corallifolia. Then third is Haridra. Haridra everybody knows, turmeric, which is Curcuma longa. Then Mundi, that is Sphaeranthus indicus. Then Neem, that is Azadirachta indica. Then Manjishtha, which is Rubia cordifolia. Then Sariva, that is Hemidesmus indicus. So all these herbs we are going to study today. And the herbal supplements which contain these herbs, like these tablets which we find here in Ayushakti, like Suniram tablet, then the skin tonic tablet, the Suvarna tablet, and the Sudharu Doshan. So we are going to study about this. Yes. Next slide, please. So skin, beauty, and hair. So everybody wants a good skin, the texture of the skin, complexion, luster, good hair. But here we also need to understand that beauty is about the body and the mind. When the mind and the body, they both are happy inside, it radiates in the form of the beauty on the face that we see. And all these herbs, they just bring out that beauty, they radiate that beauty with their properties. And what are these herbs that we are going to study today? So one of the most important herb is khadira. So the Latin name of this herb is Acacia catechu, and English name is the Kutch tree. It is called as the Kutch tree. So what is English name? English name is for the reference. In whichever place it is referred by different names, that's why we call it as that name. But the standard, what we see, the scientific name is Acacia catechu. In the picture, you can see the khadir tree. Next slide, please. Yes, so if we look at the rasa, what is rasa? So for people who have joined new, I will just revise the concept. So rasa is about the taste, the different types of taste. So there are 6 different types of taste, which is the sweet, the sour, the salty, the bitter, astringent, and pungent. 6 tastes. Virya is the potency of that particular herb by which the particular action is exhibited. For whatever we say, that suppose these herbs, they have actions on the skin or the hair, that is the action that they are exhibiting, and that is because of the virya or potency of that drug, which is of 2 types, which is the hot virya and the cold virya. Then vipaka. Vipaka is the transformation of the original rasa when it comes into contact with the digestive fire into 3 different types of rasas, which is the sweet taste, then the sour taste, and the pungent taste. And of course, the doshas we know, Vata, Pitta, Kapha doshas, and the 7 tissues, the dhatus, which are the rasa, rakta, mausa, meda, asti, majja, shukra. So now we see about khadir, this plant. It is very evident in this picture. So khadir, the rasa, the main rasa is bitter, that is tikta, and astringent. So in the bracket, those are the Sanskrit names. So bitter and astringent. Astringent is kashai. So mainly khadir is bitter and astringent in the taste. If we look at the potency of the herb, the potency is cold, that is shita. Then the vipak is pungent, that is katu vipak. So what is vipak? After it comes into contact with the digestive fire, it is transformed by the digestive fire into that particular rasa. And it is effective on the doshas like pitta dosh and kapha dosh. Then regarding the dhatu, khadir acts on the rakta dhatu. Just now we saw that whenever the pitta dosh is imbalanced, it directly affects the rakta dhatu, because there is a direct correlation between the pitta dosh and rakta dhatu. That's why if the pitta dosh gets imbalanced, there is a direct impact on the rakta dhatu, which is we refer as blood. And due to that imbalance of caused by the pitta dosh, the blood gets vitiated, and there are different kinds of skin and hair disorders, specifically the skin disorders. So this khadir acts very well on the rakta dhatu, as well as it acts on the meda dhatu and shukra dhatu also. Next slide, please. So if we look at the other properties of khadir, so khadir also has antioxidant properties. So this is according to the pharmacognostical studies that have been published in the journals. So khadir is said to have, by the pharmacognostical studies, that khadir has antioxidant properties also. That is why it acts well on the different kinds of skin disorders. Yes, can we move to the next slide? Yes, so the actions of khadir are, because just now we saw that the virya is cold, the vipak is pungent, and it is bitter and astringent. So it removes the toxins from the rakta dhatu. As we know, the taste bitter, it is, and astringent also, is very necessary to pacify the pitta dosh. It pacifies the pitta dosh, and there is a direct correlation between pitta dosh and rakta dhatu. That's why as soon as we balance the pitta dosh due to the rasa of khadir, which is bitter and astringent, and also the potency is cold, that's why the pitta dosh is pacified, and then the rakta dhatu is also automatically pacified. The toxins are removed from the rakta dhatu. That means the rakta dhatu, whatever vitiation is there, that is balanced. and thus it is helpful in all kinds of skin problems. Khadir is the best herb whenever we are concerned about the different kinds of skin disorders. It is effective in intense itching. So one of the main symptoms of any skin disorder is the itching. So that Khadir provides very good results in that. It also controls the vitiated Meda Dhatu. Because of the taste, bitter and astringent, it has, and also the Vipak pungent, it has a very good effect on the Kapha dosh also. And we know Kapha dosh and Meda Dhatu are also directly related. That's why Khadir is important to control the vitiated Meda Dhatu also. And it also has anti-helminthic properties. So it acts against the different kinds of worm infestations in the body. Khadir is useful for that because we know the different kinds of worms, they never like the taste bitter and astringent. They only like the taste sweet. So Khadir, being bitter and astringent, also has very good action on the different kinds of worms in the body. And that's why it has the anti-helminthic action. Yes, we move towards the next slide. So now we will see that the Ayushakti supplements that contain Khadir, they are Suniram, and the numbers are the quantity of Khadir in that particular formulation. So that is 111 milligrams. Then skin tonic, 30 milligrams. It contains Khadir. Suvarna, it contains 100 milligrams of Khadir. So Suniram, skin tonic, and Suvarna, the supplements, they contain the medicinal herb Khadir. Next slide, please. Now we move towards another very important herb, Bakuchi. So Bakuchi, the Latin name is Soralia coryllifolia, and the English name is the Soralia seeds. So Soralia coryllifolia. Bakuchi is another herb, very important herb as far as the vitiation of the Rakta Dhatu is concerned and pacification of the Pitta dosh is concerned. Next slide, please. So if we look again at the rasa of Bakuchi, it has bitter taste, the Tikta ras, the pungent taste, that is the Katu ras. Virya is hot, that is Ushna. Vipak is pungent, which is Katu. And regarding the doshas, it is effective on the Kapha and Vata dosh. And regarding the dhatus, it acts on the Rakta Dhatu mainly and the Meda Dhatu. So this is about Bakuchi. Next slide, please. So now here we understand and remember that Bakuchi, by its prabhava, or we can say the extraordinary action, and also due to its properties, it is very effective in cases of leukoderma. So leukoderma is where the person gets white patches on the skin, and that is leukoderma. So Bakuchi, as Acharya Charak says in the Charaka Samhita, that Bakuchi has a very specific action on this leukoderma, and it is very effective on the cases of leukoderma. So Bakuchi is extremely helpful in leukoderma. Then in skin disorders, as we saw, it acts on the Rakta Dhatu. That's why it is very effective in the skin disorders. And also it removes the intestinal worms as it contains the rasas bitter and pungent. So that is about Bakuchi. Next slide, please. The Ayushakti supplements that contain Bakuchi are Suvarna, and it contains 225 milligrams of Bakuchi. Suniram, it contains 75 milligrams of Bakuchi. So that is about this herbal supplements. Next slide, please. Suvarna and Suniram. Then we move towards, yes, everyone knows and everyone is well aware of Haridra is like a boon to mankind. Some herbs are like the most essential and they are really like a boon. Out of that, Haridra, the turmeric, is one of them. The Latin name is Curcuma longa. English name, we know that it is called as turmeric. So Haridra, next slide, please. So Haridra, the rasa is bitter, that is tikta, and it is pungent, so it is katu. Virya, the potency is hot, that is ushna. Then the vipak is pungent, which is katu. Regarding the doshas, it is effective on the kapha and pitta doshas, and the dhatus. Regarding the dhatus, it is effective on the rasa dhatu, the rakta dhatu, and meda dhatu. So mainly these three dhatus. Out of that, rasa and rakta, mainly rakta. And Haridra is also said to have anti-inflammatory properties and antibacterial, anti-helminthic properties, according to the pharmacognostical studies. And Haridra has been used since ages for various kinds of wound healings, or to increase or enhance the luster of the skin, the complexion of the skin, because of the properties that it has. Next slide, please. So Haridra, it removes the toxins from the body. The most common herb that we use here in India, and also maybe in many countries for daily cooking, we use Haridra because of the properties that it has, the antibacterial, anti-inflammatory properties, and it removes the toxins from the body. It is a good, extremely good antioxidant. It improves the complexion. Just to apply the paste of Haridra also externally and also internally taking Haridra, it improves the complexion of the skin, very natural remedy. Then it is helpful in all kinds of skin disorders. It is used as an anti-helminthic because again, the taste of Haridra, we saw that Haridra is bitter and pungent in taste. That's why the worms do not like it. So it is anti-helminthic. And it also controls diabetes. So this reference about Haridra in the treatment of diabetes has been given in the Ayurveda classics, and also it is used in Ayushakti. So it controls diabetes, and also it is effective on cholesterol because of the rasa being bitter pungent and the virya hot and the vipak also pungent. That's why it helps to reduce the cholesterol also. And here we can see the picture of Haridra, the herb, how it grows. Very wonderful it is. It looks also beautiful and it makes the skin also beautiful. Next slide, please. Then the Ayushakti supplements that contain Haridra, they are skin tonic, and it contains Haridra in the quantity of 200 milligrams. Then Suniram, it contains 79 milligrams. Then Suvarna, 75 milligrams. And Arshana tablet, it contains Haridra in the quantity of 35 milligrams. Even if you don't remember the quantity, we can just remember which herbal supplements the Haridra is found in. So skin tonic, Suniram, Suvarna, and Arshana. Next slide, please. Then we move towards the herb Mundi. So the Latin name of this herb is Sphiranthus indicus, and English name is East Indian globe thistle. So Mundi. Next slide, please. So the herb Mundi, it has the rasa. The main taste are predominant tastes are bitter, which is tikta, pungent, that is katu, then sweet, that is madhur, astringent, that is kashai. And the virya or potency is hot, it is ushna in the virya. The vipak is pungent or katu. And regarding the doshas, it is effective on all the doshas. And regarding the dhatus, predominantly it acts on the rasa dhatu, the rakta dhatu, and majja dhatu. Here again, we have to remember and keep in mind the concept that some herbs, they act according to the rasa, some they act according to the virya, some according to vipak. And there is also a concept of prabhav, which is the extraordinary action of that herb for which we cannot give any logical reasoning. So this we have to keep in mind. Next slide, please. So Mundi is extremely useful for all kinds of skin disorders. It is effective in the conditions like herpes. It works on the intestinal worms. So again, Mundi being bitter, astringent, it works on that, and a good brain tonic also, and nerve tonic. So Mundi is a good brain tonic and nerve tonic, and also it has the anti-inflammatory and antimicrobial activities also. So next slide, please. So the Ayushakti supplements that contain Mundi are skin tonic, and it contains 100 milligrams. Then Suniram, 26 milligrams. Suvarna, 50 milligrams. So skin tonic, Suvarna, and Suniram. Yes, next slide. Now we move towards neem. So neem, again, even if it is bitter, it is extremely, extremely helpful. Again, another herb which is a boon to mankind, we can say, and most commonly used. The Latin name is Azadirachta indica, and English name is the neem tree. So neem, next slide, please. So the rasa of neem, everybody knows it is extremely bitter, tikta. Then virya is cold, that is shita. Then vipak is pungent, which is katu. And regarding the doshas, it is effective on the kapha and pitta doshas. And if we look at the dhatus, it is very useful in the rakta dhatu, the meda dhatu, and also in the shukra dhatu. So neem, even if it is bitter, it is extremely useful. Next slide, please. Yes. So neem is useful for different kinds of wounds and ulcers, because we know main thing which is there in this conditions is the antimicrobial and anti-inflammatory activity of neem. So that because of that, neem has that wound healing properties. And also it is helpful in the different kinds of skin disorders. It reduces the itching, it relieves the burning sensation, and it works on the intestinal worms. So neem, because it is bitter in taste, that's why it pacifies the pitta dosh, because we have learned that to pacify the pitta dosh, the bitter taste is extremely beneficial. And along with that, neem is also cold in potency. That's why it reduces the burning sensation, the itching, and also it works on the intestinal worms. Next slide, please. So the Ayushakti supplements that contain neem are skin tonic, which is 150 milligrams. Then Arshana, it is 17 milligram. Suvarna, 100 milligrams. So skin tonic, Arshana, and Suvarna, they contain neem. Next slide, please. Then Manjishtha. Again, Manjishtha is a very important herb as far as the skin disorders are concerned, because it has a very great effect on different kinds of skin disorders. Manjishtha also looks very beautiful. If you can see in the picture, the herb Manjishtha. So Latin name is Rubia cordifolia, and English name is the Indian Madar. So Rubia cordifolia is the Latin name. Next slide, please. So Manjishtha, the main rasa or taste is astringent, which is kashaya. Then bitter, which is tikta rasa. Then sweet, which is madhura rasa. So astringent, bitter, and sweet are the predominant taste or rasa of Manjishtha. Virya, if we look at, the virya is hot, which we call as ushna. Then vipak is pungent, which we call as katu. And regarding the doshas, it is effective on the kapha and pitta doshas mainly. And the dhatus, it acts very well on the rakta dhatu and meda dhatu. And also Manjishtha has the anti-inflammatory, antibacterial, and antioxidant properties. Next slide, please. Yes. So right now we saw that Manjishtha, it improves complexion. In all kinds of skin disorders, Manjishtha has very good action, because it works on the skin disorders, and it has taste like astringent, bitter, and sweet, which all three are necessary to pacify the pitta dosh. That's why it is helpful in all kinds of skin disorders. It works on the rakta dhatu. It is anti-helminthic. It acts against the different kinds of worm infestations. Useful in leprosy, hypopigmentation, some of the skin disorders. It heals the ulcers also, because it has the antibacterial and anti-inflammatory property. And also useful in conditions like vitiligo. So Manjishtha, if we just say the name, just remember that Manjishtha is extremely useful in all kinds of skin disorders, and we can use that in all kinds of skin disorders. Next slide, please. And Ayushakti supplement that contains Manjishtha is skin tonic, and the quantity is 150 milligrams. Next slide, please. Then we move towards Sariva. Again, a very, very beautiful herb, beautiful looking herb. You can see very delicate and extremely useful in the skin disorders. So the Latin name is Hemidesmus indicus. English name is Indian Sericea perilla. So Sariva and Manjishtha, remember Sariva, Manjishtha are the best herbs as far as the different kinds of skin disorders are concerned. Next slide, please. If we look at the rasa or the taste of Sariva, it is sweet in taste, which is the Madhura rasa. Then the virya or potency is cold, that is Shita. Then the Vipak is sweet, that is Madhura. And regarding the doshas, it is effective on all the three doshas. And regarding the dhatus, it is effective on the rasa dhatu, the rakta dhatu, or rasa rakta, meda dhatu, and shukra dhatu. So rakta dhatu, all the herbs are effective, and that's why we are studying it today. And look at the picture of Sariva. There is a specific shape of leaves. We can easily identify Sariva because of very delicate plant and a specific shape of the leaves. I think we have seen Sariva when we have visited the herbal garden in the education week. If I think I'm not wrong, yes, we have seen it. So next slide, please. Then Sariva, it acts as a blood purifier. Then it is anti-inflammatory activity of Sariva, useful in itching and pruritus. Then it removes the toxins from the body, and also it removes the bad body odor. The unpleasant body odor is also removed by Sariva. Sariva basically acts as a cooling, it has a cooling property, and it has a blood purifier property. That's why it pacifies again the pitta dosh, and it also has the anti-inflammatory activity. Again, Sariva is extremely helpful in all kinds of skin disorders and to pacify the pitta dosh. Next slide, please. So Sariva, it is available in the Ayushakti supplements like Skin Tonic 125 mg and Chandrika Ras 26 mg. So Sariva being cool in nature, cool in potency, that's why it has that cooling property, and also it purifies the blood. That's why we find it in Chandrika Ras. Chandrika Ras again is used wherever, for burning sensations, wherever the heat is increased, we use Chandrika Ras. And one of the main contents is Sariva, and of course Skin Tonic 125 mg. So next slide, please. Now we move towards the herbal supplements. Now we have studied the single herbs. Now we will move towards the herbal supplements. Next slide. Yes. So here is a case study of this client of psoriasis. So we can see the before and after pictures. Clearly it is evident of drastic change. We can say almost 95% change is there in this. There was big psoriatic patches were there on the leg of this client, and afterwards with the right treatment, it got healed. So we see this in this case study. So next slide, please. Then Suniram, the next tablet is Suniram. So the first column, again, it contains the Sanskrit name, second is the Latin name, and the third is the quantity in milligrams. So first is Khadira, which Khadir is found in Suniram, and the Latin name is Acacia catechu. Quantity is 111. It is present in the largest quantity. Haridra, Curcuma longa, 79 mg. Then Bakuchi, Sorelia coralifolia. Then Devdaru, Cedrus Devdar, Kankol, Piper cubeba, Malaki, Amblica officinalis, and Bibhitaki, that is Terminalia bellerica. These are the contents of Suniram. And Suniram, as we saw, because of the herbs that it contains, and just now we studied Khadi, Haridra, Bakuchi, Amalki, Bibhitki, we know already. Devdaru, we have studied. That's why it is extremely beneficial in all kinds of skin disorders like psoriasis or any other, itching or most of the skin disorders. Next slide, please. So indications of Suniram are all types of skin problems like psoriasis, urticaria, leukoderma, post-acne scarring, pruritus, and nowadays most of the skin disorders are again increasing because stress is also one of the main factors which aggravates the skin disorders. It directly has an impact on the skin because skin is a very delicate organ, and that's why we see that the skin disorders are increasing. Of course, the wrong diet and lifestyle is one of the main reasons, but another reason is also stress, the psychological stress. And all these herbs they have a healing property on all the aspects of the body, just not the physical, but also the mental. And that's why they heal the disorder as a complete. Just now we saw the case study of psoriasis. So these herbs have a complete effect on the body and mind as well. Then it is also effective in abscess, then worms, pimples, then the burning sensation to improve the skin complexion. So Niram is very effective whenever some skin complexion is lost. Again, the skin complexion, we can see different reasons are there. Mainly when the rasa and rakta dhatu are imbalanced, when the food is not in the proper quantity and quality, food is not there, then directly it affects the formation of the 7 tissues. The rasa dhatu is affected, which has a direct impact on the rakta dhatu. So in that conditions also we can use Sunira. Then also to remove the toxins from the rakta dhatu. So again, Suniram tablet is very useful in all these skin conditions. Next slide, please. So if we look at the overall property of the herbs in Suniram, so it is cold in property. The dose is in adults is 1 tablet twice daily. In children, it is half tablet twice daily. And contraindications are not there, till now not observed as such. Next slide, please. So now we study this case study of acne. Yeah, acne is another very most common problem, especially in the females. Males also suffer, but females are more prone because the main reason being the stress and hormonal imbalance. So this was a case. This is a case study of this client. Again, a female client, Preeti, 42 years young. She was suffering from these symptoms, and not just the acne, they were painful acne on the face and nose, and it was quite chronic for 1 year. And definitely, skin problems are clearly visible, and that's why it makes a person conscious, and it has directly an impact on the psychology and the mind. And it is like a cycle it forms, that because of this, because of stress, the skin disorder is there, and because of the skin disorder, the psychology is affected, and the person becomes more depressed and sad. So it becomes a chain. We need to break that chain. So in her case, she was afraid of socializing because of the, it was clearly evident on the face, and in the picture also it is evident. And when she came to us, she was really depressed, really sad. The psychological status was completely imbalanced. And we examined her. Of course, the rakta dhatu was vitiated in her case. The pitta dosh was imbalanced. We found that from the nadi pariksha which we do in Ayush Shakti, and also by history taking, we found that she was following the wrong diet and lifestyle, and also she was having some kind of stress, and that stress was aggravating all these conditions. And she also had hormonal imbalance. Her menstrual cycle was also affected, and that was evident on in this form of symptoms. So see, whenever there is something manifesting on the skin, definitely there is imbalance inside, because this is just a manifestation that we are seeing in the form of skin disorders externally. So the root cause is there inside, that we need to find and treat it accordingly. So in this case, we gave her the customized detox plan and the diet and lifestyle changes, and the herbal supplements that mainly included Suniram, along with the other herbal supplements like skin tonic also. Then after 3 months, she had 90% improvement. This you can see in the after picture, quite that is gone, almost it is gone, and the pain was completely reduced. She regained her confidence, and she was no longer afraid or to socialize or embarrassed to socialize. So again, we understand that the herbs, they work on the psychology as well, not just that physical factor. The herbs have that, we can say they are really divine, because they really heal the complete body, mind, sensory organs, and of course the soul. Next slide, please. So skin tonic is the another herbal supplement. So here, skin tonic contains neem patra ghana. Ghana means the extract form. So the Latin name of neem is Melia azadiracta. Quantity in milligrams is 150 milligrams. Then khadir, acacia catechu, it is in 30 milligrams. Then haridra ghana, curcuma longa, 200 milligrams. Sariva, which is Hemidesmus indicus, 125 milligrams. Then mundi, Just now we saw these herbs, Mundi, Sariva, Haridra, Khadir, and also neem. Then Takla Bija Ghar. Takla is another medicinal herb, Cassia tora, and Manjishta Ghana. So when we use the Ghana, that is the extract form of the herbs, it increases the potency of that complete herbal supplement. It makes it even more powerful. That's why we see the results faster with these tablets. Next slide, please. So, indications of skin tonic tablet are all kinds of skin disorders. So, skin tonic, actually, it as the name suggests, it is really a skin tonic because it is extremely helpful in all kinds of skin disorders. Skin tonic, so it's really a tonic. And disorders like psoriasis, eczema, urticaria, the different rashes, urticaria, then dermatitis, pruritus, and itching. So skin tonic contains the herbs that just now we saw, and that is why it is really effective. Next slide, please. So if we calculate the overall property of skin tonic, it is hot in property. The dose in adults is 2 tablets twice daily, and in children, it is 1 tablet twice daily. Contraindications are not observed as such. Next slide, please. So now this case study of urticaria, which is also called as hives. So of this female client, and she is 72 years young, and she had symptoms like allergy related skin rashes for 20 years. As in urticaria we see there are different kinds of rashes, and most of the times it is quite chronic. The people, they're really irritated, and because it is again quite visible on the skin. It affects the mental status and it affects the social status also. And she did the biopsy and was diagnosed with urticarial vasculitis. And it is in this condition we see that there are long lasting urticarial skin lesions having poor response to treatment. So she had took different kinds of treatments, but she was not getting any good relief, and that's why she came to Ayushakti. And we again examined her and found the main condition that was imbalanced. Again, the Rakta Dhatu was vitiated. There were some psychological problems also. So we counseled her also, and we provided her customized detox plan, the diet and lifestyle plan, and herbal supplements like Suniram, Skin Tonic, and y2s3 Jeevan also. So in her case, we found that there was bhej also in her pulse. That's why the y2s3 Jeevan was also provided, and it was allergy related also. And after 2 years, she had 90% improvement, and her social and her emotional status was also quite, it was balanced, and she became happy again, because in this cases again, the overall social status is affected. So that was, again, it became normal. Next slide, please. Then we move towards the Suvarna. So here it contains Haridra Ghana, Longa, 75 milligrams, Khadir Ghana, which is Acacia catechu, 100 milligrams, Neem Ghana, Azadirachta indica, 100 milligrams, Bakuchi Ghana, that is Sorelia coralifolia, 225 milligrams, Kankol Ghana, Piper cubeba, 50 milligrams, then Mundi, Sphiranthus indicus, 50 milligrams, and Chakramarda Ghana, which is Cassia tora, 50 milligrams. So again, the herbs are in the extract form, the Ghana form. Next slide, please. So the indications, yeah, there's some disturbance. I think some noise is coming. Indications of Suvarna are vitiligo, dermatitis, pruritus, itching, and also for rejuvenation, because it contains the herbs in the extract form. That's why. So it is helpful in these conditions. Next slide, please. The overall property of Suvarna is hot. The dose in adults is 1 tablet twice daily. In children, it is half tablet twice daily, and contraindications are not there. Next slide, please. So this is case study of vitiligo. Clearly evident the before and after pictures. After 2 months, the white patches which we see in vitiligo, they were 80% better. So again, vitiligo is actually very difficult to treat. But in this case, after 2 months only, this client had 80% improvement. So this was a client, Pratik, 12 years young, so quite young. And he was having the white patch under the right eye, which is, we can see in the before picture. And he followed the detox, he did the detox and also the diet and lifestyle. So remember that along with the herbs, the proper diet and lifestyle are also very essential in all kinds of disorders. Then also herbal supplements, including Suvarna. And after 2 months, he had 80% improvement. So if we follow the right kind of healing path, understand what is the pathogenesis, rule out the causative factors, then we can get results like this in quite a short period of time, like 2 months. So this is this case study. Next slide, please. Then Sudarun lotion. I just love Sudarun lotion because I've seen the effect of Sudarun lotion in most of many, I can say all of my clients. It is really wonderful. So Sudarun lotion, Neem Patra, Latin name is Melia azadiracta, Haridra, Curcuma longa, Khadir, Acacia catechu, and Jati, Jasminum grandiflora. So Darun lotion is really, really very effective. Of course, all the other herbs are also very effective. Next slide, please. So Sudarun lotion, we give it for external application. It is extremely beneficial in all kinds of skin disorders like eczema, the scar after burns, psoriasis, dry skin, dandruff, dermatitis, and we apply it locally for local application. So Sudarun has really very good effects. Next slide, please. So overall property of Sudarun lotion is cold. We apply it locally only, not to give it internally. And there are no contraindications. And yes, next slide, please. So this is a case study of this patient so of psoriasis. Rajendra, male patient, 45 years young. In the before and after pictures, there is really a drastic change. This is clearly evident. So he had a plantar psoriasis. Psoriasis happens in different parts of the body. Sometimes it can be scalp. So in this case, it was plantar psoriasis, and he was suffering from it since 2 years, quite chronic. And there were also bleeding cracks, fissures on the soles, which is again clearly evident in this picture. He was finding it difficult to walk or stand, because we know that generally, even if we have cracks on the soles, it is very difficult. But these were like the psoriatic dispatches, and it was also bleeding. That's why it was extremely difficult for him to even walk or stand. And we gave him the customized detox plan and diet plan and leech therapy. So leech therapy is the Raktamokshan therapy, where we just, there is an insect, leech, which we apply on that part, and then it sucks out the impure blood. So leech therapy is extremely beneficial in such cases. And also the herbal supplement like Sudarun lotion. So in these cases, Sudarun lotion is really very effective. So after 3 months, the cracks were healed. After 6 months, he had 90% improvement. So yes, this is a case study. And also the herbal supplements like skin tonic, Suniram, they were also given. Kaishar Gugur were also given to him. So this is the case study. Next slide, please. Yes, we come to the end of today's session. So thank you very much. So we have studied about the skin disorders today. And next time we will be continuing another part of this. So yes, Cornelia, would you like to explain the challenge activities? Thank you very much. Namaste.
Yeah, first of all, thank you, Dr. Kamal, for another really good session today, and pointing out the connections between all the rasa and vipaka and the different doshas and dhatus. And yeah, you saw the challenge activity is the same as we had before. Try those one of those supplements maybe on yourself or on one of your patients, and observe what's happening when they take them on a regular basis, and then also report again in your in your group, PASS group, and so we can have discussions about the results, or also in the 3-year PASS big WhatsApp group. Okay, so we have already a few questions, and the first one with a hand up was Roxana. You were very quick, so why don't you go ahead?
Thank you. Thank you, Dr. Kamal. Thank you, everyone, for your patience, and thank you for the education. My question is in regards to Suniram versus skin tonic. And if I'm making a choice for a patient who presents with generalized facial, just acne or vitiligo, not vitiligo so much, but just patches on the face, is it that skin tonic, because it has Ghana, is the extracts is more powerful than Suniram? How should I choose that?
Very nice, intelligent question.
I
Very
think
specific
we lost
question.
Dr. Kamal for a moment.
Very specific question. Good. Suniram, the content, ingredients of Suniram are more helpful to remove the toxins from the blood, from the tissues,
Mhm,
separates the toxins.
mhm.
It helps to remove, clear heat from the body.
Mhm.
Even in a way, if we see that the Suniram, it works as when the blood gets purified. So it becomes from thick to thin.
Mhm, mhm,
All the toxins are out, but the blood becomes very clean, pure.
mhm, mhm. As opposed to skin tonic?
Suniram also helps in the heat because it works on the heat part. So heat, not only in the blood, but other dhatus as well.
Mhm,
Sometimes there are the clients coming with the complaint of low sperm count.
mhm,
In the semen analysis, semen graph, we understand that the sperm counts are less than the actual required.
mhm.
Then from the pulse, we understand there is a heat, and then to separate the heat and to remove from the body, we give this Suniram.
Okay.
Suniram also helpful in the condition of not only the related, the skin conditions. When there is no dandruff, but only heat and hair fall is there, we suggest Suniram.
Mm.
Skin tonic. Skin tonic is helpful to restore the blood dhatu function. So in this meaning, we need to consider and understand the function means pitta related function. because blood dhatu has so many functions as a blood, but here the skin tonic is working as after the purification, after the removal of the toxins. Now it helps to fix restoration, improve the Rakta Dhatu quality, nourishing the Rakta Dhatu, blood tissue quality. So the things that has gone will not come back easily. This disease that we have removed with a lot of efforts that won't come easily back.
Thank you, Dr.
Here
Heman.
we give the Suniram and skin tonic, differentiate two different, but still in the some conditions we give only one or both.
May I ask, so we should start with Suniram then for 6 to 8 weeks and then follow up with skin tonic 6 to 8 weeks, or give them simultaneously?
Depending what is the problem.
Mhm.
In the some situation it is only required just Suniram.
Mhm.
There is no need of skin tonic. In some situation where we see the problem is very chronic, deep rooted, then we need to give both. We work on the both area side by side, removal of the toxins and the nourishing,
Mhm.
restoration of the blood dhatu together.
And if I may, one more follow-up question regarding the Sudarun lotion. Is that something, I know a lot of clients come in, they want to have beautiful skin, so is it something that when I give them these Suniram or the skin tonic, I can also say, apply this to your face? Because that's mainly what people are concerned about.
Very good. Now, what is the definition of beautiful skin?
Beautiful from the inside, mind, body, and soul.
Exactly. Because beautiful has a many different meaning.
Yes, they want clear skin.
Because sometimes people have a just dry skin. Then yes,
Mhm.
the Sudarun is helpful, whether on the face or body, anywhere.
Thank you so much.
If people have itching, rashes, like a psoriasis, eczema, dermatitis, neurodermatitis, urticaria, skin allergy, dandruff, many different skin disorder, we can recommend just Sudarun lotion. But if there is a specific concern of beautiful skin, means some pigmentations, some dark patches are there, some black marks are there, and want to remove them, then there is another cream. And it's known as Sukanti. Sukanti face cream. Sukanti face cream. The full name is, because there are the two different Sukanti, not to get confused.
Thank you.
Sukanti freedom means useful for the pain condition, joints. And Sukanti face cream is a useful for the face mark, and it helps, and it can be used as a sunscreen.
Ah.
People can go outside by applying in the sun, heat and all, and skin will not get affected or maybe less affected. And if people can, if the person who wants to remove the dark patches or black marks, if hyperpigmentation, some kind of things, then need to rub, massage this cream. Good.
Thank you.
Wonderful.
Thank you so much.
Nice, nice.
Afsani, you're next, and then Ilka.
Thank you very, very much. Very interesting lesson. I have three questions with your permission. One is about Sudaron lotion. That was given to a client with psoriasis, but she didn't use it after about 1 month because she said it dried the area very badly and it made her itchy, the area. So when do we use that, and why is she getting dry skin? Does it cause dryness, or
Shall I? Yeah.
Yes.
To answer this question. Okay. So this dryness could be because of the toxins inside.
Okay.
This dryness is coming from the toxins. We need to remove the toxins, then to apply Sudaron. So it's a proper solution, proper treatment, complete treatment. Otherwise, it's just externally. You are applying, suppressing toxins. And when you suppress the toxins, it reacts differently.
Yes. So does she go on like mung and vegetable diets?
Depending on how much toxins are there, which condition is there, maybe in some situation just mung vegetable detox is helpful or enough. In some situation, need to give some additional supplements as a Suniram or skin tonic and Virigen. In some situation, maybe that is also not enough, need bigger detox. So depending on the different chronicity, acute condition, how much deep the toxins are, then we can decide, recommend the right solution.
Can I ask my second question?
Yes.
Okay, I have a student, she's epileptic. When I took her pulse, she's very high in water. And I also, when she told me she suffers from epilepsy, I assumed that it must be a water problem, vitiated water or high water. And when I took it, she was really high in water. It was going 3 up. And so I'm not, what herbs can she take that can help her? And what marmas?
Good question. Where is the vata, high vata?
Apanavata.
Yeah. In which area? Which part?
It's going up to Pitta, then it's going to what? To the head.
Yeah.
So it's
So
affecting
if
the
it is going
nerves.
to the head, then give bliss and brainto.
Bliss and brain too.
Yeah.
Brain too.
So first thing is important in the pulse, which dosa is aggravated, imbalanced. Then to understand in which part it is, this imbalanced, aggravated, disturbed dosa is affecting, influencing which part of the body, mind and emotions. Accordingly, we can give our recommendation.
And is there a home remedy that she can use if she cannot buy the herbs?
Yes. So maybe the ghee massage on both side temples
Ghee
can be
massage.
helpful.
Okay. Okay. Would the forgive and forget marma be helpful if she? I'm assuming because she's going to be very anxious, thinking she might have a fit any moment.
For sure. Forgive and forget marma. Very good. Very nice.
Sorry, I'm writing this. My next question. for now is diabetes type 2. I have another student. I have so many clients now that I take their post. Actually, when I say
Great.
client, I practice taking their post.
Super.
And she told me she has type 2 diabetic. She's a type 2 and she uses insulin. And so I believe that diabetes, because it's related to pancreas and to, the insulin levels. So I'm assuming it must be a kapha problem because her body type is kapha. And first I want to know, when I took her post, I couldn't, when she told me, I was trying to see any difference. Where, on which post do I feel diabetes? And what does it look like when I take the pause? 2, apart from the amla, the turmeric, and the fenugreek, is there any other home remedies that I can recommend for her?
Good. So normally in the diabetes, you feel the beige in the pulse. And the home remedy that you mentioned is more than perfect. Amlaki, fenugreeks, turmeric, perfect.
Also, sorry to interrupt, Dr. Naram, I don't know where I saw this. I'm sure there was a video that Dr. Naram had said to use black cumin powder in one of his,
Yeah.
like half a teaspoon, black cumin powder.
Yes, yes. Yes, but it is in the specific condition. Black cumin powder is with the specific condition of the body. Like this home remedy that like a fenugreeks, amlaki, and turmeric can be used to any diabetic client.
Okay.
So definitely this can be given. And also maybe, I don't know if it is available or not. I think it is common. Bitter gourd.
Okay.
The juice of bitter gourd is also very helpful.
And how does she take that juice?
The morning on empty stomach before breakfast, half a cup bitter gourd juice to be taken in the morning.
Half a cup.
Half a cup.
The thing is that the amla, the turmeric, and the fenugreek, she has to take on empty stomach. Which one does she take first?
So whichever the test he is comfortable, she's comfortable, can take first.
Okay.
Like a fenugreek or this, or then the second.
Okay.
Both are for the diabetic condition, can be taken either or first or second. Won't make any difference.
Thank you very, very much. Thank you. Much appreciated.
Yes.
Ilke.
Hello, everyone, and thank you, Dr. Komal and Dr. Hemang, for this wonderful session. I still try to figure out the part with the potency, hot or cold. At the beginning, I thought it would be important when I create a remedy, like in this case, maybe skin tonic, I put herbs inside, which at the end, in total, will be cold in potency because it's a remedy for high pitta and for the skin. Now you showed skin tonic is at the end hot in potency. This makes me crazy. Why? Why isn't it? Why don't you create it like this, that at the end it's cold? Then it's logical in my mind.
Super. Very good.
No, not super.
It's a good question.
Yeah.
In the beginning of this session, was talking about the two different types of pitta disorders, pitta problems. One with when pitta is getting increased quantity wise, then we need to give the herbs they are cooling, like Chandrika Ras, Pitta Samak, Gulka seed, Ayur seed. Okay.
Mhm.
When another possibility is when Pitta is quality wise not good, disturbing, polluting the skin, blood tissues, and developing skin condition, then to give the different herbs. Now, I can give a one simple answer to this question. It works like an iron cuts the iron. Iron cuts to the iron. To cut iron, we need iron, strong iron. Then only it's getting cut. So here we don't want to give cooling herbs and to suppress the toxicity.
Mhm.
If any skin problem and people you give the Chandrika Ras, it will suppress the toxin inside. But in some situation, we give when there is a heat also. We need to deal smartly in some situation where we are working with the hot and cold, both remedies together in one person. There are the conditions, especially autoimmune conditions. Delicate situation. Small mistake can make a big problems. Need to adjust the dose very smartly.
Wow, thank you. Very interesting and very deep.
Good question. Appreciate. Very nice.
So we have Andrea and then Debra.
Yeah, thank you so much, Dr. Kamal, Dr. Hemang. One of the remedies mentioned is leech therapy. Now, are the leeches disposed of after each use?
Normally not. Can be used at least 3 times, 4 times. But depending, sometimes, if the leeches are not so healthy, then we have to use it only once. Normally, they are usable, reusable.
What if the patient has AIDS?
But yes, but the leech is we use on the same patient again. We reuse, but only on the same patient, not the different.
Okay. And my other question is, could leech therapy be used in a complex case as sepsis?
Sepsis, I don't think so. No. Sepsis
Okay.
is no.
Thank you.
Good. We will see this leech therapy in the India week. We have considered it in the program because it is available at most of the places. And it is possible to do also. If you learn it nicely, you can do it. You can help with this process to your clients. It's helpful for many different disorders, but specifically in the skin condition. Yes, it is a natural, the leeches have a natural quality, strength, skill, that it's sucking only the impure blood and then throwing, vomiting, everything. So again, it's clean. And then after 15 days, we can reuse. Is ready to again suck the blood, but only impure. The moment it will receive the pure blood, it will stop. It's a natural strength to the leech. Universe has given this special quality to these leeches. We will see this in the detail, practical during the India week. Yes.
Deborah?
Thank you so much. This has been a great session. I have two questions. One is we're talking about skin issues. And if I recall correctly, when we are looking at an issue that's caused by blood, we needed to go back to the previous tissue, which would be plasma. So my question is, these, and of course the plasma is the result of digestion. So if you have someone who has poor digestion and they're doing everything, like they're doing the diet, they're being really cool, not necessarily following all the lifestyle changes, are there other remedies that would assist them in digesting properly so that the plasma would be good, so the rakta would be clean?
Good. Very good. Very good question. If any of you have your own experience of skin condition, and if you have consultation with any of Ayush Shakti Vaidya, or else any of your clients had this skin condition and you were there in the consultation and you know the prescription, you have seen that along with the Suniram and skin tonic, always we are prescribing, recommending Amrut Ras. And that is because of correction of the Agni and balancing 3 dosas from the beginning, means from the digestion to the plasma fire and previous, like this. Good observation. Good.
Thank you. My second question is, I think of, and I may be thinking of this wrong, but I'm thinking of the digestive tract as being like skin. So if you have an issue like Crohn's disease, are these remedies effective on that type of internal skin?
Yes, for sure. It's absolutely perfect understanding. The digestion has a big influence in all the diseases and especially on the skin. And for the ulcers inside, we are giving the same skin tonic. It's outside or inside, the same remedies are working and helping.
Thank you so much.
Nice. Thank you. Superb.
Okay, another question from Afsani.
Sorry. I forgot to ask. The girl with epilepsy, can I put drops of nutmeg with ghee in her
Sorry.
nose? Nutmeg with ghee, the drop in her nose, in each nostril. Would that help with epilepsy to calm her mind, to calm her down? Or no?
Maybe it is working, but I have not seen any reference to this, or maybe I missed it somewhere to read, but I haven't seen this like this.
Yeah, two more questions.
Yeah.
Two more. On the skin issues, if there is toxins, would application of ghee directly on the skin, would that extract some of the toxins away? Would it help?
Yeah, in some condition, yes, and somewhere it will aggravate.
Oh,
Like a wet eczema or some oozing is happening, and then maybe just application of the ghee can be, problematic.
What about neem powder?
Yeah,
Just
neem powder in that situation is good in the like when the oozing or wet eczema condition is
and
there.
do I need to add water to the neem powder, or you just apply it?
Just you can put it on the powder in the wet condition in this such situation. No need to add water or anything normally. Just put this powder on the part.
Okay, and this is just because if it's oozing, you put the neem, but if it's not oozing and it's dry,
Yeah.
do I still? Okay, thank you
Yes.
very much.
Welcome. Good questions.
Are there any more questions concerning skin conditions, what we heard today?
I believe that many of you are again and again saying that you are using and applying this information.
I think Radu has a question.
Yeah, it is possible, please. I would like to ask something about the situation I had before with a client. She had I don't remember it. I just have a lapsus. This is that condition that affects also the nerves and the skin in the same time, and it gives sharp pain going to the nerves, which
Shingles.
Or neuropathy?
I think it's shingles. Yeah.
Yeah. So for the singles, yes, the same remedies are helpful. Suniram, skin tonic, Amrutrash, Virichan. But along with that, we need to give immuno, y2s, Virophyte, and Pain Mukti MJ. We need to give all these supplements. But otherwise, it's perfect. It's the same group. Yes.
Thank you very
And
much.
depending on the how big problem, from how long and whatever the other conditions are, the health challenges, accordingly we can reduce some of the supplements, or dose wise we need to sometimes increase the supplements, but
Thank you very
otherwise
much.
the correct line of treatment.
Great. Thank you very much.
Perfect. Thank you. Good. Yes.
Anya, and then Arati.
Hello, namaste. Thank you for this nice session. I have a question regarding the fact that a lot of the herbs are working on pitta and kapha, and also on the meda dhatu. So I don't really understood the connection between these effects. So yeah, would be nice if you could clarify it.
Yeah. Later on next year, when we will talk about the disease, you will
Okay.
see that the many skin disorders have are influenced from the polluted kapha as well. When there is a the condition of itching is coming from the kapha. Rhesus, it's a kapha. We need to separate this kapha, mucus, slime, mucosity. Then we can say, remove the pitta. Pitta is a liquid. Kapha is a sticky. Together they produce many skin disorders, and the most important, most common symptoms is itching.
Okay.
They are together. When there is only like a pitta problem, pitta condition, then we find the heat in the pulse less beige or no beige.
Okay, thank you.
Good, good.
All right. Yeah,
Yes.
I hope you can hear me.
Yes.
So I have a question regarding the pitta detoxing. So here I remember from the last session with Dr. Smita Naram, she mentioned Virachan as a possibility to reduce pitta, also a light detox diet. And so I assume that would be also what would be used here in case of these skin conditions with as part of the detox program. And so in addition, I wanted to ask now a person who has got a thyroid condition and thyroid also belonging into the pitta group, and if they already have diarrhea going on, would they still have to go through a Virachan process, or how would be the recommended detox for them?
Good. So respond to first question. Virachan tablet. Yes. Virachan tablet is necessary, mandatory for all the skin condition. Sudhiram separates the toxins from the tissue, but after separating, we need to remove, throw from the body, and that happens only by Virachan tablet. So that is for sure. And Virachan tablet is helping to remove the excessive heat, pitta, toxins, in any case, whether you have a skin disorder or not. And that is why we use it in our detox program, like a Virachan program, Panchkarma program. We use them. And that Virachan tablets is removing the toxins, throwing. Respond to the second question regarding thyroid. So thyroid. According to our understanding, it is a problem of what? It's happening due to the blockages in the rasa vaha strotas, blockages in the plasma channel. Problem is in the rasa dhatu. There is a problem in the fire. Which fire? Plasma fire. Plasma fire is unable to produce, it's not enough competent to work on the plasma to produce the blood tissues, rakta dhatu. Normally, you remember from the previous sessions last year in the beginning that rasa dhatu is from the rasa dhatu, Plasma fire works on the rasa dhatu and produce blood dhatu. Then the blood fire works on the blood tissue and produce muscles. Then the muscle fire works on the muscles and then produce meda. Now, in the thyroid, the plasma fire is not competent enough, not able to work on the plasma and not able to go on. So it's a type of the digestive metabolic fire. Is a problem with the dhatu fire, means metabolic fire. Metabolic fire is weak. And that is why in the thyroid condition, we are giving a Suruday, meta boost. Now, I tell you, because the first, just a minute, let me open up a slide so I can explain better way. So normally, this plasma fire works on the plasma and produce the blood fire, a blood dhatu. Then blood fire works on the blood tissues, and I am not using the word convert. I'm using the word produce, because if converts, then the whole blood dhatu should convert in the muscles. Blood remains in the body and producing the another dhatu, going to the next level. So difference between the conversion and the production. They are the producing the next. Then they go to here. Okay. Now, in the thyroid, what happens? Problem is here. All this fire are metabolic fire, and one of the fire, plasma fire, is not functioning well, and so on. This thyroid patient is having a lot of swelling, is because of the excessive plasma. Rasa dhatu is getting accumulated more and more. And that's why, if you see in these people, thyroid people have a deficiency of rakta dhatu, means low hemoglobin. If you see that they have the problem of asti dhatu, osteoporosis, hair fall, thyroid people, check their history, because one after another, the all deficiency will continue. Then if the client is a female, the thyroid client is a female, then maybe you see that that lady has a problem with the menstrual cycle. Also, if she is finding difficulty in getting pregnant, because it affects to the ovum also. So from the whole journey started from here. Because all the next dhatus are not strong enough, quality wise.
Yeah. So pretty much the problem is that the food is not getting absorbed from the gastrointestinal tract. Then they get deficient in the rasa dhatu, and then it goes on into every other tissue. So that was understood. Naturally, these thyroid patients, they will have a diarrhea. it's like a vicious cycle. Vicious
Exactly.
cycle with the diarrhea gives again abnormal absorption and so on. So is then the treatment for the person with this type of diarrhea, is that also virechen, or is that a different type of approach? Is this
Symptomatic approach at that point of time. Ultimate,
Mm.
definitely detox to be done in the root cause, to work on the root cause. When you want to improve metabolic fire, then you need to do the detox to remove the blockages, because
okay?
that
So
is the blockages in the rasa strotas, and it can be removed only with the help of proper detox.
so the entire like panchakarma type
Exactly.
detox, where you
Exactly.
have all three types of, so pretty much gastrointestinal, but also via the kidneys and via the skin detox.
Yes.
Maybe also pranayama is another option, but that,
Additional.
so
That's
yeah,
additional.
okay, all right. So all right, thanks. That was helpful to understand.
Good.
Thank you very much.
Wonderful. Nice.
Sorry to say this, but does it mean that it is a pitta condition? Isn't it? If it's to do with blood, it's a pitta condition, the thyroid problem.
Thyroid problem is the problem with the metabolic fire. Now, two different entity, two different things. Pitta, also called and known as a fire. But here we are talking as a typical fire, Agni. So not to get confused, we rather use the word as Agni. In the problem, thyroid is because the Agni, problem in the Agni.
Okay. I think I understand.
Yes.
Dr. Hemang, we just had the question, is it possible for us to get that slide that you just showed?
Yeah. Yes.
Could you share that in the group so we can distribute it to everyone?
Yeah. Yes.
Thank you. Andrea, we have another question here.
Thank you again, Dr. Hemang. Now, I know we're going to be doing face reading in the future. Is it too early for me to ask a question concerning thyroid, that it will show up in the eyebrows, thinning or shortening? Am I correct with that? Or should I wait till we get to that?
Yeah, maybe you are right. But honestly saying, I'm not good in the face reading diagnosis. So I can't like tell you or guide you or judge you or anything that it is right or wrong. But should be right. Should be. But Dr. Smita is good in that. Maybe she can explain the more detail and guide properly.
Okay,
Dr.
thank you
Hemang?
so much.
Yes, Dr. Tom. Yeah, maybe.
Hi, how are you?
Can. Yes, good, nice.
Yeah, so the classic thing with thyroid problems is that the outer 1/3 of the eyebrow thins or disappears. That's classic for thyroid. It doesn't always happen, but that is the kind of classic presentation of
Super.
hypothyroidism. Yeah.
Super. So it's a natural and classic original. The most of the time it's a common identity. Nice, good to know. Wonderful, Dr. Tom. Super. Great that you are here.
Good to be here. Yeah.
Yeah.
Great.
Nice.
Great presentation. Great questions too.
Yes.
Do we have any other questions for today's sessions about skin?
There is one in the chat.
Emma, do you want to come online or should I read it out? Okay, she can't come online. What would you use for severe bruising? Oops, sorry. And hematoma. And can a hematoma that is still present and painful after 4 years still be treated with success?
Depending, can say only after seeing some reports or pulse meeting or something. Difficult to comment just with this much of information, but hematoma, yes, we have result. But successfully treated or what, that we need a little more information. Yeah, but it is treatable and for sure we can give. Good. Superb, superb, superb. So questions comes when you meet people. So the homework to meet people, whether you help or not, whether you give your recommendation or not, but at least talk and understand what are the symptoms are there, what can happen to them, what type of the disease condition is possible. So at least we can have like a when sometimes I'm sure that everyone in this group and like understanding all the different disease condition and the symptoms. Sometimes it is like overwhelming for and too much information, disease condition. And for that, if you go through, meet more people, listen symptoms, then it looks and finds similar and familiar. I suggest always to do a lot of consultation. Not necessary you do recommendation, but you need to be known with the, some medical terminology, some medical diagnosis. You need to know, be aware about different situations. So then when we are talking about some disease, you get an idea. And then in future, you can do the practice, you can give the recommendation. Good. Wonderful, wonderful, wonderful. Thank you for listening us patiently. Lot of time, giving us a lot of time. Nice. We'll see us again. 3rd Saturday of this month with the same topic, skin condition again. And yes, we will have like a Dr. Tom Mitchell session on March 2nd, Thursday. We have already set the calendar of all year. So you all can block those dates. Some of the dates, on, we have this classes session in the morning, India. And it is the night, late night in the US and very early morning in the Europe somewhere. So please, many of you have missed this time because the different time on the session was. So not to miss, we have mentioned the different time in each session wise. Please check it carefully, block the timings. We will again share the information time to time every month. And normally we have enough number for our India tour, but still, by any chance, if anyone wants to join, most welcome. Not to miss this opportunity.
Are those going to be in our education portal calendar? Because I didn't see the last one, and I don't see Dr. Tom's on there for the second.
So yeah, good question. Good. So we have received the updates from like our colleague that many of us, not many, but the few of us are not in the main group of our 3-year path, the WhatsApp group. That is the main group, but they are in the individual group, means path 1, 2, 3, 4, 5. They are in that member in that particular group, but not in the main group. Check yourself. If you are in the both, you should be, each one of us should be in the both, like a main 3-year group and also in the individual group. If not, then please add yourself. Ask us to add you in this or that, because it is a feedback from an observation from our colleagues that few people are not there in the main group, but they are there in the individual groups. So you miss the information. The point is, because sometimes we are unable to put every information in each group. We just post them and any announcement in the main 3-year group. And we set the calendar in the 3-year group. It is there. So check not only about this calendar, but many times, many disease discussion or these education discussions are happening in the 3-year group. So you will miss if you are not member of the main group.
Dr. Hemang,
Yes, please.
just so you know that there are people that are not able to use WhatsApp. So we have a 3-year path Telegram group, which I have been copying and pasting things over there when I remember to do so. I haven't been 100%. So I missed this Thursday session because I didn't see it until almost 10 o'clock myself. So I was able to get on because it was posted in the WhatsApp group, and I forgot to post it in the Telegram group. But just so you know that there are a bunch of people that cannot use WhatsApp. So I've been putting stuff over there in Telegram.
Find some solution. I don't know what is the solution. Maybe you
Okay.
someone has some suggestion what to do for this situation.
Okay. Just so you know, that's what's been going
Because
on.
here in India, we are using only WhatsApp.
I understand.
Yeah. And good, appreciate your support that you are forwarding all information there. That's good, but I don't know if something else we can do. Maybe any of you have any suggestion, you can. Yeah, we are very happy to receive, and if possible, we will do everything, whatever the best we can do. But one thing is for sure, that it is good to be there in the main 3-year group. Maybe you are not happy. Email is difficult, Ilke, because Google has a limitation. If we need to send the email to individual, maximum 5 people together. We cannot send all the 100 people and then it's not. Google has a limitation. It's going into the spam. When we put the bulk, then you won't receive the email. And it is really practically not possible that for every announcement and everything message, we send 20 emails. We five email, like we select and putting, that's not practically possible. maybe not using the WhatsApp for other purpose, but at least for this and only for these two groups, like a 3-year main group and your path group, 1, 2, 3, 4, 5, whichever relevant to your membership. At least it is good. But anyway, if anyone has any other suggestion, we are open to make changes. Good. Thank you. And see you on 18th. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you.
Thank you, everyone, and namaste.
Thank you, Dr. Kamal, Dr. Hemang.
Thank you, Dr. Kamal. Thank you, Dr. Hemang. Thank you, everybody.
You.
Thank you.
Thank you, Dr. Kamal. Thank you, Dr. Hemang. Love you.
Thank you. Love you and with you.
Yeah,
See you
love with you.
soon. Thank you,
Love you and I'm with
everybody.
you.
Thank you.
Thank you, Dr.
Thank you.
Komal.
I love
Thank you,
you
Dr.
and I'm with
Hemang.
you. Thank you.
Thank you.
Thank you.
Thank you.
Thank
I
you.
love you. I'm with you.
Thank you.
Hemang, Dr. Komal.
Yeah.
Thank you. Great.
We don't want to go. We want to continue with this lesson.
Yeah.
Sorry, no sleep for you guys in India.
We are looking forward to see all of you in India. All
I
of
can't wait to see and hug
Yes.
you, Dr. Kumar. I can't wait.
you. Yes.
Just waiting
Dr.
for
Komal.
the visa now. Yeah. Thank
Dr.
you,
Komal, I
thank you.
have a question.
Yeah.
I just wanted to check. Is that okay? It's Yasmin. I just want to check the Panchkarma week. Where would we be staying? Would we stay at the Ayurvedic clinic or Shakti clinic, or would it be somewhere else?
So Rupa is the right person to answer this question.
Okay. Okay.
Where like she has booked accommodation for you.
Okay. Okay. And Dr. Hemang, I have directly sent you a question. If you can please help with that. I'm really
You
struggling
sent
at the
me
moment.
by WhatsApp.
To your personal
WhatsApp.
WhatsApp, please. Yeah.
Okay.
Yeah.
We'll
Okay.
check.
Thank you so
Yeah.
much for today's session. Great session. Thank you.
Thank you.
Thank you.
Great.
Thank you, everyone. Bye.
Thank you. Bye
Thank
bye.
you.
Bye bye,
Bye.
Radu.
Good night,
Jaina.
everyone.
Bye. Thank you. Thank you. Thank you, Sanjay. Bye. Thank you. All good. Nice. Sachinji, thank you. Afsane, Steve.
Thank you. Thank you.